3,000 years ago, if your vision faded into a milky fog, someone would strap you to a chair, hold your head perfectly still, and stab a needle straight into your eyeball while you were wide awake. No anesthesia, no antibiotics, just a steady hand, a sharp point, and a prayer. And here's the insane part. It actually worked. This is the true story of how ancient civilizations fought blindness with nothing but bronze, gold, boiling butter, and terrifying courage. Stick around, because the final method on this list is still being used today, and doctors are begging people to stop. Quick refresher before we go back in time. A cataract happens when the lens of your eye, the clear part that focuses light, turns cloudy. Over years, proteins inside it clump together and the world slowly dims, like looking through frosted glass. Today, it's a 15-minute outpatient procedure. You walk in, you walk out, you see again. But for most of human history, cataracts simply meant permanent blindness. There was no fixing it. If you were lucky enough to live somewhere with a skilled healer, though, you had one terrifying option. It's called couching, and it is one of the oldest surgical procedures ever performed by human hands. Our story might begin in ancient Babylon, with one of the oldest law codes ever written, the Code of Hammurabi, carved around 1750 BCE. Buried among laws about property and marriage is something remarkable: rules about eye surgery. The code even set a price list depending on the patient's social class. 10 shekels of silver if you operated on a nobleman's eye, 5 for a commoner, 2 for a slave. And if the surgery went wrong and blinded a nobleman, the surgeon could lose his own hand. Historians still debate exactly what this eye surgery involved. Some believe it was an early crude version of couching, literally pressing and rubbing the eye with fingers to try to dislodge the clouded lens. Fast forward to ancient Egypt. Inside the Valley of the Kings, in the tomb of a royal tomb builder named Aipui, there's a wall painting believed by some scholars to show a healer treating his eye, possibly evidence of cataract surgery. Over 3,000 years ago, the Egyptians were obsessed with eyes. Just look at the Eye of Horus, one of their most sacred symbols. Egyptian medical texts describe eye treatments using ground minerals, animal fat, and even honey as an antibacterial dressing thousands of years before anyone knew what bacteria were. Some accounts describe a healer using a fine tool to push cloudy matter aside, then soaking the eye in warm clarified butter before bandaging it shut. It sounds bizarre, but butter has natural soothing properties, and shockingly, it may have actually helped prevent infection. But if couching has a founding father, it's this man, Sushruta, an Indian physician working around 600 BCE, whose writings are collected in a text called the Sushruta Samhita. Sushruta didn't just describe eye problems. He described an actual surgical technique, step by step, in a level of detail that still stuns modern doctors. Here's how it worked. The patient was bathed, oiled, and made to sweat, then seated and told to stare fixedly at their own nose. The surgeon would take a curved needle and pierce the side of the eye, using it to push the clouded lens down and out of the line of sight, down into the vitreous, the jelly-like interior of the eyeball. Push the cloudy lens out of the way, and suddenly, light can reach the retina again. The patient couldn't focus clearly anymore. The lens was just floating loose inside the eye, but blurry vision was infinitely better than total darkness. Afterward, the eye was soaked in warm butter and bandaged, exactly like the Egyptian method. If it worked, and if infection didn't set in, a person could go from total blindness to functional vision in a single afternoon. This technique was so effective that it began traveling along the Silk Road. It spread into China, where it merged with acupuncture traditions and became known as Jin Pi Shu, practiced for over 2,000 years, all the way into the 20th century. It reached ancient Rome too, described in detail by the Roman writer Celsus. It spread through the Arab world, through medieval Europe, through Africa. For over 2,000 years, across completely different civilizations that had never even met each other. This same basic idea, push the cataract out of the way, was humanity's best shot at restoring sight. Now here's the part they don't put on the museum plaque. Couching was brutal, and it was a gamble every single time. There was no anesthesia beyond herbs and willpower. There was no sterilization. Infection could set in within days and cause permanent blindness or even death. And even in a successful surgery, the patient was left severely farsighted for life since the eye no longer had a lens to focus with. Many patients needed thick corrective lenses just to see clearly afterward, and those wouldn't exist for centuries. Success rates are impossible to know precisely, but historians agree complications were common. Couching didn't cure blindness. It traded one kind of vision loss for a chance at a better one. And yet, people lined up for it because the alternative was permanent darkness, and permanent darkness meant you could no longer work, walk unassisted, or care for your family. In a world with no social safety net, blindness could be a death sentence all its own. Here's the part that should genuinely surprise you. Couching never fully disappeared. In parts of sub-Saharan Africa and South Asia, traditional couching is still practiced today, sometimes by traveling healers with no formal medical training, using tools that would make a modern surgeon's stomach turn. Modern ophthalmologists are actively campaigning against it, and for good reason. Without sterile technique, the complication rates are devastating. Infection, permanent blindness, and worse are tragically common. Public health organizations have run entire campaigns just trying to convince rural communities to seek modern cataract surgery instead, which, in many cases, can now be done for a shockingly low cost or even free through charitable eye camps. It's a strange kind of full circle. The same basic technique that represented humanity's cutting edge in 600 BCE is now considered a public health emergency in the 21st century. Proof of just how far modern medicine has actually come took until 1747 for a French surgeon named Jacques Daviel to attempt something radically different in Paris, actually removing the cataract entirely instead of just pushing it aside. It was risky, painful, and far from perfect, but it was the first real step away from 3,000 years of couching. From there, it was another 2 centuries before an English doctor named Harold Ridley pioneered the intraocular lens implant, replacing the clouded lens with an artificial one, restoring not just some sight, but clear, focused vision. Today, the same operation that once required a steady hand and a prayer takes about 15 minutes, uses ultrasound to gently break up the cataract, and lets most patients see clearly again by the next morning. So next time you or someone you know gets cataract surgery and complains about a slightly bright waiting room, remember, 3,000 years ago, the treatment was a needle to the eye and a prayer to the gods.